Alright, let's break down Down syndrome within 3 minutes. No fluff, just the essentials. First off, what is Down syndrome? It's the most common chromosomal condition worldwide, affecting roughly 1 in every 700 live births. The cause? Trisomy 21. That means there are 3 copies of chromosome 21 instead of the usual 2. It's mostly a random event linked to non-disjunction during cell division. Age of the mother plays a big role. Risk increases with maternal age, especially after 35. Now, what are the key features? Think physical, cognitive, and medical. Physically, you might see hypotonia, so floppy babies, flat facial profile, upward slanting palpebral fissures, and a single palmar crease. Don't forget brush-field spots in the eyes, and a wide gap between the first and second toes. But remember, every individual is unique. These features can vary widely. Cognitively, there's a spectrum. Most people with Down syndrome have mild to moderate intellectual disability, but the focus should always be on their strengths and abilities, not just limitations. Medically, there's a higher risk for several conditions. The big ones: congenital heart defects, especially atrioventricular septal defect. Watch for GI abnormalities like duodenal atresia or Hirschsprung disease. There's also increased risk of leukemia, hypothyroidism, hearing loss, and even early onset Alzheimer's. Regular screening and early interventions can make a huge difference in outcomes. So how is Down syndrome diagnosed? Most cases are picked up prenatally using screening tests, like nuchal translucency on ultrasound or cell-free fetal DNA in the mother's blood. Definitive diagnosis? That's a karyotype showing the extra chromosome 21. After birth, diagnosis is usually clinical, but always confirmed genetically. Management is all about multidisciplinary care. Pediatricians, cardiologists, speech therapists, occupational therapists, the whole team is involved. Early intervention, inclusive education, and regular health checks are the backbone of care. Most importantly, people with Down syndrome can lead fulfilling, meaningful lives. If you remember one thing, make it this: Down syndrome is about much more than a list of features or risks. It's about seeing the person first, practicing empathy, and advocating for inclusion and respect. Alright, that's Down syndrome in a nutshell. Quick, clear, and straight to the point.